In 1998, there was little interest in the private or public sectors in biosecurity and biodefense. Likewise, there was nothing taught in schools of public health or medicine in this area, and precious little support from the donor community. Nevertheless, we were able to bring together a small group of individuals and create a center.
So we wanted to build an organization that had the freedom of a think tank, the analytical rigor of the best universities, and which embodied a commitment to work in partnership with government and industry.
In those first few years, we were very small. You could have fit a staff meeting in the size of a closet. We published a few key articles, and we had the first ever civilian biodefense conference. And to our great surprise, more than 1,000 people showed up.
So when I left DoD and came to CSIS's think tank, I thought we had an obligation to try to expand public consciousness and policy thinking about bioterrorism. And it led us to this remarkable partnership with Tara O'Toole and Tom Inglesby, where we started exploring it and ended up in this now famous war game we did together called Dark Winter. It had more impact than anything that I have done at CSIS because it transformed thinking in profound ways, and it gave me an understanding of the crucial role that think tanks can play in policy formation.
I don't think any of us that participated in this exercise realized the impact it would have. And it taught me that policy institutes can play a huge role, not simply by publishing detailed analytical documents, but by showing the real world to policymakers and helping citizens understand the nature of the challenge that policymakers face.
So after 9/11, the workload and sense of urgency at the center increased dramatically. Thankfully, we had been given a very generous grant by the Alfred P. Sloan Foundation around that time that allowed us to increase the number and range of expertise of our staff. And then in 2003, we were recruited by Upmc, who endowed us in a way that allowed us to further expand our expertise in depth.
The center truly is an invaluable and unique national resource. It has served on multiple occasions as an honest broker to help us advance the policy and strategy to secure this nation's health.
5 days after 9/11, Tommy Thompson called DAN to help him manage the crisis. And he's not the only one. I'm proud to say that over the next decade, more than a dozen of my center colleagues have been called to serve in government.
But it's not just preparing our own staff for service in government. Through the Emerging Leaders in Biosecurity initiative, we're preparing the next generation of leaders.
The Atlantic Storm exercise was a turning point that showed how a health security event in one country could have a global impact.
I was pleased to work with Tom Inglesby and Anita Cicero last year in a program sponsored by the Center to deepen habits of cooperation, openness, transparency, and disclosure with our colleagues from the People's Republic of China. I also reviewed the excellent study on public health preparedness in Taiwan, which the center did in collaboration with Taiwan officials. It was a model which should help improve cross-strait safety in the event of a critical health or biosafety emergency.
Taiwan Ministry of Health sought out the center to do an independent assessment of Taiwan public health emergency preparedness program. And after a series of interviews, site visits, the centers successfully complete an in-depth analysis for Taiwan CDC and health ministries, and yes, with many useful recommendations.
Now we're the UPMC Center for Health Security. We're dedicated to protecting people's health from the consequences of epidemics and disasters and ensuring communities are resilient to those challenges.
Changing the name of the center is a great idea. It really reflects what's going on in the world today.
In my mind, health security is as vital to protecting our nation as national defense is.
There are a lot of partisan disputes and arguments in Washington, but one thing that people agree on is the need for health security, because it's absolutely vital to our families, to our communities, and to the country as a whole.
Here is some of what my center colleagues and I are doing to strengthen health security.
Studying the risks and benefits of synthetic biology.
Using telemedicine to identify emerging infectious diseases.
Preparing healthcare systems to deal with the next disaster.
Fostering the next generation of biosecurity leaders.
Tracking health security news to keep the community informed.
Reducing the time it takes to diagnose infections.
Improving the use of volunteers in disasters.
Helping cities protect people in a nuclear crisis.
Making mobile health technologies useful for public health officials.
Identifying the best emergency plans around U.S. nuclear power plants.
Analyzing cyber threats to public health.
Publishing research that makes a difference.
Collaborating with other countries to improve global health security.
Building smarter and faster biosurveillance systems.
Well, it sounds like you're going to be busy and there's a lot to do. The issues of health security have never been more important, and the extraordinary thing as we celebrate the 15th anniversary of this great organization is to remember what the world looked like 15 years ago and how really this nation was not taking these threats seriously, whether they were naturally occurring biological threats or those deliberately caused. This center has really helped shine an important spotlight on these issues, has helped educate the nation, importantly policymakers, but all of the stakeholders that need to be engaged. Congratulations to D.A. Henderson for having the vision to create this organization and to bring in such an extraordinary group of people, including, of course, Tara O'Toole and now Tom Inglesby in critical leadership roles. It's been a wonderful partnership. I've been so pleased and proud to be a part of this organization, and I wish you all best and congratulations.